It's Dr Rick back again with another update regarding the COVID vaccination programme in our local area of Tameside and Glossop. So lots of people are now starting to ask, so how safe is this vaccine? Well, now that we've given a couple of million doses across the UK, it's turning out that this vaccine is extremely safe. There seem to be no reports of long-term consequences and only a few reported cases of short-term side effects. And of course, the common side effect is feeling a bit achy the day after, maybe a little bit fluey and having a painful arm. So in the UK, the people who decide how safe a vaccine is are called the MHRH. And that stands for the Medicines and Healthcare Products Regulatory Agency. And they are completely independent of the government. And they do all the checks around these vaccines. So currently there are 3 vaccines they've done all the checks on. That is the Pfizer-BioNTech vaccine, the Oxford-AstraZeneca vaccine, and the Moderna vaccine. Now, so far as I know, only the Pfizer and the Oxford vaccine have been used in Tameside, and I'm not aware of the Moderna supply coming yet. Now, of course, as we're starting now to immunise people who are younger, another question that's popping up is it safe if you are pregnant or breastfeeding? So there are many people out there who have conditions that make them extremely clinically vulnerable or taking medication that makes them vulnerable. And it's a really, really important question. So far, what the government tells us is that there is absolutely no evidence that COVID-19 is unsafe if you're pregnant. But they're edging their bet slightly, saying but more evidence is needed before everyone who's pregnant can be routinely offered it. So there's another group of organisations called the JCVI, which is the Joint Committee on Vaccinations and Immunizations. And they've come out with a couple of recommendations. So if you're pregnant and you're at high risk of getting coronavirus because of where you work, or you have a health condition that means you're very high risk of serious complications, then you should get the vaccination. And that's what they recommend. They also recommend you can have the COVID-19 vaccination if you're breastfeeding as well. But if you've got some worries about this, they do recommend you speak to your healthcare professional before being offered the vaccination. And in Tameside and Glossop, what we're doing at the moment, we have a special hotline to the gynecology and obstetrics department in our local hospital to ask them really particular questions that you may give to us. And so hopefully you're going to get the most evidence-based and up-to-date information possible. Also, they're telling us that you don't need to avoid to get pregnant after you've had the vaccination. There are some people who are worried they might have the jab and then get the vaccination, and this may affect their child. At the moment, there is absolutely no evidence that the vaccination causes any damage to the newborn baby or one developing inside you. And I'm pleased to say our vaccination programme is still going exceptionally well. We've immunised the vast majority of people aged over 70, health and social care workers, people with learning disabilities, and a vast number of people with conditions or taking medication that makes them clinically vulnerable.